First, I'd like to ask your take on China's COVID policy pivot, because as China starts to lift COVID restrictions, the infection numbers are shooting up. Do you think such consequence is inevitable? Could China have done it in a better way?
Unfortunately, yes. China could have done it in a better way. But they reach a position right now where they cannot maintain that zero policy. And they didn't have a plan B to do something differently than what they had. And suddenly they have to move from zero to none and let down all these restrictions. So the consequences are, unfortunately, are going to be difficult for China, simply because many people in China are susceptible to COVID due to less infection because of the policy of zero COVID. And many people in China, especially the elderly, are not vaccinated. And if they have been vaccinated, they have been vaccinated a long time with waning immunity, they're susceptible again. And we have a variant that's circulating in China, BA1, BA2, and BA5, that are highly transmissible, but in a way is not as severe as Delta or previous variant. But still, we expect a lot of deaths in China in the coming months.
Could you maybe tell us a little detail about how bad this consequences will be? Like how many deaths, how many infections, hospitalizations, how much the burden will be?
If you look at our projections, and we're about to release new projections right now for China, if they maintained this policy, no new mandate will be imposed in China. We're looking about 500,000 deaths by April 1st. But if they impose some mandates when they see mortality going up, we are projecting about 290,000 deaths by April 1st. So that's a large number. If you look at it from a hospitalization standpoint, if they don't impose any new mandate, we're expecting that there'll be a surge in hospitalization. It will peak about 160,000 by March, towards the end of March 20. That will overwhelm their hospitals and will overwhelm their facilities. If they impose some mandate, we are projecting that this will go down to about 95,000 hospitalization by April 1st.
So actually, I want to follow up on the mandate that you mentioned. What new mandates do you think the Chinese government could take to avoid more infections than necessary?
Let me tell you what's working right now for China. They have high mask wearing among the population, which will help them. And also what we are seeing right now in China, for example, if you look at Beijing, when cases started going up and mortality increased, many people stayed at home. So people on their own, they're realizing that there are more infections than they are staying at home. What we expect that China will not allow COVID-19 to rip through its population, even with this abandoning the zero COVID policy. What China will do is the moment cases start going up, hospitalizations start going up, they'll put back in place mask mandates, of course, which they are in place, but they would limit mobility of the public, and they will shut down certain areas, basically telling people, please stay at home. And people will do it simply because cases are increasing in their own community.
I think in another interview, you mentioned something like only about 25% of those in China have immunity against Omicron. So I want to ask why 25%, because according to the Chinese government, their vaccination rate has reached somewhere around 90%.
Even in the United States, where we have a higher vaccination rate by mRNA vaccine, and we have a new booster designed for Omicron, we also don't have high immunity against Omicron. And the reason in China we don't have high immunity for Omicron simply because many people have not been infected. So if you look right now in the United States, for example, to give you a comparison, in the United States, about 97% of the population have been infected by COVID-19 at one point in time. Whereas if you look at China right now, only about 11% of the population have been infected by COVID-19 at one point in time. So there is a large segment of the population in China who have never been infected by COVID-19. That's one. Two, the vaccine used in China does not have the same effectiveness that mRNA vaccines that are being used in other countries. And that's why its effectiveness is lower to start with. Plus, most people in China who have received the vaccine received it more than 5-6 months ago. And because of waning immunity, they have no immunity anymore for COVID-19 right now. So the success of vaccination in China that happened early on, in a way, they're paying the price of that success simply because people right now have a waning immunity. What China needs to do today is to vaccinate again, provide a booster, irrespective of what vaccine. Doesn't have to be mRNA. Of course, mRNA will be better, but even using the local vaccines, that immunity will boost, especially right now in winter. For some people, it may be late because you need to take the booster and wait 2 weeks or 3 weeks after it for the effectiveness to start and the immunity to start. But China's best answer right now to this rise of COVID-19 is booster vaccination, ensuring they have antiviral medication and provide it to people who get sick, to limit the number of people who will be in hospitals, and of course, to save the medical system.
This virus in China has become much more infectious than what I know of or experienced here in the United States. I heard people telling me that, you know, they call the virus just by talking to a delivery person or just going out of their apartment and throw out trash. And on New York Times, you know, they interview someone who says, you know, I have half or over half of my friend circle has caught it already within weeks. Which echo my experience talking with my friends and family in China. So what's different in China and how do you make sense of it?
No, that is nothing different here. Let me explain it. So if you look here, when Omicron hit us in the United States, it spread so fast in a very short time. The only difference, many people in the US, by the time Omicron arrived, were either vaccinated by mRNA or have been infected. But in a short time in the US, 95% of the population have been already infected. And those people who have never been infected or not vaccinated, they get it very fast. And yes, Omicron, BA1, BA2, BA5, these are super spreader. I could sit down next to you and talk for a brief discussion. And yeah, I could, you know, pass the virus to you. So that's what people in China are describing. Remember, they don't have immunity. And then they are out and about right now. And there is a variant that's circulating that's highly infectious. So that's expected to happen. And it happened in the United States. And you've seen the curve, epi curve in the US went down so high and came down because of the nature of the virus that we are dealing with right now. The variant that we are dealing with is highly infectious. I'm not surprised at all that it's spreading so fast.
Do you have an estimate for China about when it's going to be normal?
China will come like everybody else, where COVID-19 will become endemic. It's something that's spreading in the country like flu before, sometimes in May and June, simply because many people will be infected between now and then. This is exactly what happened with us in Omicron. You know, after February last year, April last year, COVID-19 will still see cases going up and down. But most people are not wearing masks anymore. Most people are flying without masks. And life is kind of back to normal with some seasonality where cases will increase in winter because it's a seasonal virus. But yes, China will go back sometimes in May, June to be normal in terms of infections, wave, seasonality in winter, like what we are seeing right now in the United States.